Assalamu alaikum. This is Dr. Ziaur Rahman from Dr. Zia's Dental Care, Lahore. We have a case of mucocele in a female patient that appeared in the lower lip, and it was on the right side of the lower lip. And as we can see, it was interfering with the speech of the patient, and it was interfering with the masticatory functions, and it was exactly coinciding with the canine of the right side, upper and lower both. And probably, as the history indicates, the patient told that it probably erupted as a result of a traumatic injury at first, which later on developed into a full-blown independent mucocele, and now it was causing the traumatic uh, bite or trauma while the patient wanted to chew or speak in both functions. So as we can see, the lesion was quite big, and the patient was explained about the procedure a little bit, and the patient opted for the procedure, and we removed the mucocele effectively and very carefully. Initially, to start with, we made an elliptical incision, uh, as it is very common along the base of the mucous, facing towards the sulcus area, and we exposed the mucocele very carefully just to ensure that none of it was ruptured, and the objective was to remove the whole mucocele along with its sac. So as the elliptical incision was made, we were able to access the swelling, and then the swelling was detached from the underlying tissues by the help of a scissor. The scissor was used in a closed manner, and then it was advanced inside the soft tissue, and then it was opened. The purpose was not to damage any structure underneath, but to separate the mucocele effectively from the soft tissue that was surrounding the mucocele itself. And we were quite successful in that, and we were able to carefully remove the entire soft tissue from the mucocele attachment, and the mucocele was then extruded with the help of a little digital pressure from the labial aspect, and it just popped up. So um, when it was out, we were able to locate its stalk and its major attachment, and it was secured with the help of tissue faucet, and the whole mucocele along with its content was easily removed and excised. The area afterwards was closed using silk sutures, 3 by 0, interrupted, and as we can see, the size of the lesion was roughly around 10 millimeters, and the patient was happy. Then we recalled the patient after 9 days, and it showed satisfactory healing in the area. Some topical covering agent was advised to the patient. Analgesics were advised as a standard precaution. No antibiotics were used during the entire procedure. No prophylactic was required, and the patient healed perfectly well, and the patient was also happy. The swelling had gone, and a normal lip architecture was preserved. Now the patient is quite happy with the final result, and will probably put her on a 1 month follow-up just to make sure everything is all right. Thank you very much for watching, and subscribe to our channel.